is. That's what's about conversation style. What's up,
Absolutely. We're
everyone?
just
It's
gonna
your girl
laugh.
Sequoia Blue, and we have a special guest. We got Jenn Johnson in the building, and we're just having a red wine combo tonight.
Absolutely.
It's yes, and she's an ER nurse turned author. She's gonna tell us about that nurse life because it ain't for the weary. It's just not for the weary.
Right?
I grew up with
Oh my
nurses,
God.
and all I gotta say is that man, there might be times where you go in the bathroom and sneak something in your mouth, sneak some liquor in or something out there.
They know. They know. There's no fooling us. We're so used to people just like lying to us 90% of the time, whether they realize that they're doing it or not. They're lying. And so it's my job to just
Mm.
assume that I'm missing something. And that's just the way she goes.
Oh my goodness! So, what made you want to become an ER nurse?
So I fell face first into it. I started out as a biology major, was doing that, and the university that I was going to had a really big forestry program. So Northern Ontario, very, your typical Canadian lumberjack kind of feel, where the biology portion was very plant-based, not at all people-based. So I'm like, "Oh man, this sucks." And
Mm.
I forgive me for my children who are running in and out. They're trying to carve pumpkins last minute.
Oh goodness!
And
Yes, almost time for
oh my god,
Halloween.
Samhain is coming. And so, yeah, ended up failing the first half of organic chemistry my second year
Ooh,
and thinking like, you know what, this is very obviously not for me. What else can I do? And I happened to have a girlfriend in first year who had been in nursing programs, and we'd go through her textbooks and we'd go through and we're like, look at all these ridiculously gory photos. We're like, oh my God, this is cool. Like, this is what I want to be learning. And so
wow.
swapped into a nursing program, ended up finishing it in 3 years. Thankfully, they had a compressed option, which was really, really nice,
Mm.
and started my career in a hospital that was so small. There was only one registered nurse for the ER, one registered nurse with two LVNs on the medical floor, and you would just swap. So one day you were in the
Mm.
ER, the next day you're on the floor, and you just kind of flip flop all over. So again,
Mm.
never my intention to do emergency nursing, but very
Wow.
much it found me, and my personality type and my undiagnosed ADHD fits very
Oh
well
dang.
into the ER. So it's
Yes.
been an entire career of this ER, that ER, trauma center, a pediatric center,
Wow.
ridiculously small rural ER, and everything in between. And
Mm.
it's been a lot of hilarity, but like absolute gong
Mm.
show 9 times out of 10.
Wow. I mean, what would you say the day in life was like? Was it just you running up and down the hall? Did you get a chance to eat, use the restroom? How was
No.
that?
So day shifts right now in a kind of medium sized ER. Day shifts right now.
Mm.
Why, Gordon? Have children,
It's
they
a
said. It
rooster.
would be fun, they said. I can't even. Thankfully, it's still warm enough for them to go outside in just like t-shirts, in
Oh, good.
good old Canada. And so, um, yeah, so oh my gosh, where was I going? Oh, the day in the life. So day shift is typically, I don't get a break to eat. It's a lot of handheld
Mm.
stuff, ready to rock and roll, eat when you can, versus night
Mm.
shifts is, sometimes we had an hour and a half to 2 hour nap break. It's nice.
Oh.
But with everything happening, the elderly population, there's no beds in the community, there's no movement on the floor, the medical beds,
Mm.
there's sometimes 100 and what was the last one? I think 180-hour wait to get a bed after you've been admitted in the
Oh,
ER to
dang.
go to the floor. It's not
Mm.
perfect, but it,
Mm-mm.
it is what it is. And sometimes people will get admitted and stay in the ER their whole stay and then get discharged from the emerge without ever making it to the medical floor.
Oh, dang.
But it's different. It just, we're every day is a little bit different, but yet there's always a theme to the day. So is it abdo pain day? Is it chest pain day? Is it fractured,
Mm.
bone day? Is it mental health day? There's usually you figure out within the first few hours usually what kind of day it's going to be. And hopefully if it's just an ortho day, so broken bones
Mm,
or an abdo pain day, usually those go by pretty quickly. It's the chest pain days where lots of investigations, lots of repeat testing, that people are there
mm.
for at least a minimum of like 6 hours if they're going to go home, and then potentially getting admitted. So the days
Wow.
are a little bit varied. You do have your moments to sit down and chart, but charting comes first, eating comes later if you're lucky. So you're like at the nursing desk and just like trying to like, you can hear the patients, what's that smell? It smells so good. You're like, oh my God, I'm really sorry, but I just got to eat before I fall over. You're lucky if
That's
you get to go to
right.
the bathroom one time in 12 hours. It's just one
Oh
of those
my
things where
goodness.
you get used to it, and day to day it's usually a pretty decent pace. Like, I'm not running, but like I'm moving pretty quickly through the day, and just kind of bouncing from patient to patient to patient. And once mine are okay, I usually go over and see if anybody else needs any help, um, because they might be drowning and I don't even know it. And here I'm just
Yeah.
got my little
You're
walkie-talkie
like,
kind of patience, and I'm just like, do not really doing much. And this poor person back here has got 4 or 5 admits that, they're all confused. They're all trying to climb out of bed. They're all yelling or screaming or hitting. And you're like, oh, do you need a hand? And they're like, oh my
oh
God,
my
yes.
God.
Nobody's been changed, and we gotta organize the
Oh
thing. So you always want to check on your coworkers, because just because your room is okay does not mean that anybody else's room is
no.
okay.
Oh man, that takes some patience. Like, I mean, would you recommend this job to someone that don't have any patience whatsoever?
To
Like,
be fair,
they're just
we
doing it for
lose a lot of
money.
patience. We lose a lot of patience along the way because, you know, people come in who should have gone to their family doctor. They should have gone to urgent care or a walk-in clinic. And then they're usually the ones who shouldn't be there are usually the most vocal about being there and waiting. It's like, well, of course you're waiting. You're not that sick. The life and death,
Mm,
very, very sick patients, they're the ones who are going to get the care first, as it should be, because this is an emergency
yeah.
room. And so if you're not having an emergency, you probably shouldn't be here. Just because you want test results early, or you finally have time after 16 years of smoking to check out your why you have a chronic cough for 17 years, and you're like,
Oh man.
ma'am, are you kidding me right now? Like, are you short of breath? Are you having chest pains? Like, is there a reason why you're here? No, I had time. I'm like, how long have you been smoking? 17
Oh
years. And how long have you had the cough again? Oh, 16. Of course you've had a cough for 16 years. Like, you've been smoking for 17. So you're like, "Okay,
yeah.
ma'am, well, it's gonna be a
That's
bit of a wait. I'm real sorry about that, but thankfully think of it as a little bit of a gift, a little bit of a tweak in perception. You're well enough to wait. You don't want me pulling you
mhm.
in ASAP, because that means you are hella sick and we need to do things immediately. You want to be able to sit. Like, that's a privilege to be well enough to sit in the waiting room for 4 to 6 hours
Yeah.
while you wait to be seen."
It is. I mean, and especially in Canada, you all have like the free healthcare going on, and I
Yep.
mean, it's like here in the U.S., it's like you in trouble. I mean, you go to emergency room, but it's like, that bill, or and some people don't even go have a regular insurance, medical insurance. So
One of these days, I
it's,
swear to God, somebody's got to explain to me how the US system works, because it's a little bit beyond me. Because I know that you
mm,
guys still care for those who are having a medical emergency. Like, you're still going to care for them,
mhm.
insurance or not, regardless. But I have no idea how it comes to American healthcare, and the different levels of insurance, and having to run things by people who have no medical background in order to get a
Mm.
CT approved, or a procedure approved. It's absolutely beyond me.
Yeah, it's no joke. You got to write a certain way and all types of stuff. And it's really all just made up. Like I said, everything's made up anyway. They just made it up that way to make it harder. They do what they want to do. And that's just how it is. So you just got to fight. I tell people, just don't give up. Keep going back, go different doctors, whatever. Because one of them are going to write it right. That's just how it is.
Yeah.
That's how I've been
It
getting by.
I can't imagine having, an invisible illness or a chronic illness in the US where people just want to like brush you off. It's not to say that there aren't Canadian physicians and nurse practitioners who kind of want to, brush you off, but we're all coming in for the same thing. We're all paying the same amount of taxes. So there's
Hmm.
no real incentive to see one person over the other if you're a family physician. You just go in,
Yeah,
here's my
yeah,
health
or
card,
just
and you just
true.
walk away.
That's funny. So during COVID, like how was COVID for you? Like was that I mean, I don't know how it was in Canada per se, but COVID was crazy. Like how was that in working in during COVID time? And shoot, still now is COVID still out
Yeah.
there. I mean,
It's
it's not
almost been
over.
5 years. I can't wrap my head around the fact that it's
Time
still
is
almost been 5 years. We're still
yes.
Did I really think that it was going to be 2 weeks and done? Probably not. But I think I kind of believed like, oh, after a year or two, it'll settle down and we'll be fine. Nope, here we are. We're still going, but working the ER during COVID was absolutely awful and a little bit different than
Hmm.
the States. So, I mean, we're only an hour away from New York. The border is right there.
Oh.
And we watched New York fall and fall hard. And so you'd show up to work and you're hearing these stories about, refrigerator trucks because there's not enough room in the morgue for all the
Hmm.
bodies that are happening. And so there's refrigerator trucks outside of the hospitals just to help with moving, bodies. And you're going, oh my God. And so you're just
Hmm.
waiting and you're waiting and all
See.
of a sudden nobody's coming into the ER. So normally we would see 50 to 60 patients in 24 hours. We were seeing like 10. And so all of a sudden
Mm.
it was
Oof.
this weird calm before the storm and you watched New York fall and you watched Italy fall and you watched everybody
Hmm.
struggle hard and you're like, when is it going to hit us? And we kept waiting and waiting and thank God it didn't hit us nearly as
Hmm.
hard as anybody else. And I'm not sure why.
Hmm.
But personally, I was so thankful for that because I mean, it was hard enough with what we
Yes.
were dealing with and seeing, let alone multiplying that by 10 to 100% for what all of you guys
Hmm.
were seeing. And so you'd sit there and you're like, okay, everybody's shown up to work because nobody wants to call out sick because we're all saving our
Yeah.
sick time in case we were intubated, like and had to take weeks off of work because we got COVID. We didn't know. So everybody just showed up. Nobody
Hmm.
picked up overtime. Nobody called in sick. We just showed up. You did your shifts that you were scheduled and you walked away, and that was it.
Hmm.
And the patients that we were seeing, so those 10 patients that we were seeing were so much sicker than we were so used to. Because again, it's Canadian healthcare. If you've got an issue, you're just going to pop over to the ER if you can't get in to see your family physician when it's really not that big of an issue. But give it 5, 6, 7 days, all of a sudden that little rash is now potentially a whole cellulitis of your
Hmm.
leg and it's really bad. And now we're having to do IV antibiotics and all these things. And people were
Yeah.
so sick, and not just with like COVID or respiratory symptoms, but anybody who had a chronic illness that was kind of left
Oh.
unchecked because you couldn't go see your family doctor because everybody was doing everything
Yeah.
virtually. um, you were so sick. So those with, especially with heart failure, that were having trouble managing their water pills, all of a sudden they were coming in
Hmm.
and their extra fluid is up to their lungs and they can't breathe and they're like having such a hard time. But had they been able to come in 5 days ago, it probably would have been one extra dose of a medication through the IV and home, James. Like it would have been no big deal. But now it's been five,
Yeah.
6, 7 days later, and it's so much worse because it's been left
It
unchecked for
is.
that amount of time. So it was
See.
chaos and it was hell, but it was hell for us in the fact that we were waiting for something to happen. And thank God nothing
Hmm.
really ever did. Like we never got slammed like anybody else, at least in my ER, but the fear was palpable, the uncertainty was palpable. They were changing policies from morning to afternoon to night, and it's like 1 minute it's just droplet contact, next
Hmm.
it's spread by you have to have a mask, and the next time, oh no, now you need eye goggles, and the next time, oh no, we're back to just needing a mask. So you had no idea where to kind of fall in, like, well, what do I need to do to protect myself? Like, I don't understand. And then the
Yeah.
reusing of masks and bring your own Tupperware container to be able to like save your mask for the next shift and the next shift and the next shift
Oh
and the next
Lord.
shift was just ridiculous. It was Like I
Yeah.
hope to God I would never wish this upon anybody ever.
Mhm.
Because just the fear alone was just so it changed everything.
Yeah, I mean, it's so many people died here from COVID. It
Oh,
wasn't even funny. And some people still got something called long COVID, which I think I
yep,
got. I think I have
yep.
long COVID because I caught something even before the vaccine. People like to blame it on the vaccine. No, I got it before the vaccine. I had long COVID. I was, and it's something that we just, I don't know when they're going to work on it, but it's like I got malaise and fatigue, and I'm just like, what?
Yeah.
And I didn't
What's
have that before.
happening?
I did. I don't know. And it's like I was researching it and stuff, and I see so many people with different stories. Like I think Solange Knowles just mentioned, Beyonce's sister just mentioned she's dealing with
Yeah.
POTS and
Yes.
something else from long COVID. I'm like, huh? So you got
Yeah.
more people speaking out on it now. And I hope that they come up with something to help us because yikes, these are some young people, and there was some
Not
even
I
younger people in
know.
their 20s. I was like, what? But I know
I know.
UK is working on it. They have a
Yeah.
clinic there. They're working on investigating that. So I hope US suits up.
It's the same thing. Like I got knocked into a COVID induced asthma. So I had asthma as a kid, grew out of it, never had any issues as an adult. And since getting COVID, I think 2022, 21, 22, after the first time having COVID, um, like I was just a little bit extra short of breath and like I would
Mhm.
cough up stuff all the time and it lingered and it lingered and it lingered. I actually was able to find myself lucky enough to find myself in a clinical trial that was dealing with asthma,
Oh.
but like but I was pretty sure I'm like, "Oh no, I'm pretty sure it's like long COVID or like at least like COVID induced asthma." And even to this
Mhm.
day, like I'm a little bit more short of breath. I have to take a puffer now and again, whereas
And you're
I
young.
didn't beforehand. And I'm only
Mhm.
39. Like what the hell?
Yeah. Yeah, you're so young, like, because I could tell, and I'm like, we shouldn't be dealing with this. I mean, what
No,
is going on?
it's
It messes up the
insane.
energy. I
Yes.
mean, so I'm just like more of us speaking about it, the more we can get some studies going. And one
Yes.
thing about it is that intuition. You mentioned that you had intuition, and you have intuition about knowing that you have long COVID just as well as I do.
Yeah.
And
Yeah.
intuition is important to me, you know. And you said that you had intuition for patients about knowing diagnosis before it happened. I'm like, man, that's some stuff. Tell us about that.
It started out as a game. Like, so I when we moved from Northern Ontario to Southern Ontario, I went from a hospital seeing maybe 2 to 3 patients in 12 hours to seeing like 100. And so they'd stick you at triage and it was your job to see everybody and sort who's sick, who's not sick, who's really, really sick. And in order just to keep myself kind of entertained and going, I would start to guess as to like what people were coming in with. And sometimes it's a little easier if somebody's grabbing their chest and they're kind of like this. You're like, oh, it's chest pain or shortness of breath. If they're grabbing their abdomen, okay, it's abdominal pain. But the more I kind of leaned into it and just kind of goofed around with it, the more often it was like, oh no, I was right on that one. Or somebody would come in and they've got a vague story and their vitals aren't all that bad, but something is just saying like there's more to this story that I'm missing. Like there's something more in the background that I'm not privy to. Either the patient's not aware of it or they don't know to report, a symptom that seems very minor that would lead me to believe that something else is going on. And so I would start to kind of, okay, like there's more to this. And so I would actually like follow them through their whole ER visit, would check up on them and be like, hey, are you okay? Like, are your vitals still all right? Like, what did the lab work say? What did the CT say? And just kind of follow them because more often than not, the ones that I were following, those were the ones who all of a sudden like would drop or their status would change and then, they're having a seizure or they're all of a sudden short of breath and their lungs are collapsing and this kind of thing. And it's like, how did I know that? I'm like, I thought maybe I was just really good at my job. Like, oh, I'm a great ER nurse. Look at me kind of working. And in reality, it was like, no, there was something kind of in the back of my head going like, there's more to this. You need to investigate further. You need to push further. You need to ask more questions versus somebody who's coming in. I've got a splinter and I'm like, okay, let's do your set of vitals real quick. Past medical history. What medications are you taking? Bye, 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 bye. Gone. versus, oh, like, how long have you been having chest pain? Like, what's really going on? Is there something that makes it worse? Do you have to sleep up at night? Like, sitting in a chair versus laying flat? Like, have you had new swelling in your legs? Like,
Mm,
what's really going on? And it would lead me to ask more questions. And then sure enough, more often than not, I was getting it right, where the ones that I
mm.
was kind of following their trips through the ER, like, they were getting admitted, they were going to ICU, they were getting sent out for really serious conditions. And it's like, okay, well, again, am I just good at my job, or is, like, there's something more going on? So the more I kind of leaned into it, I wasn't talking about what I was doing, because, like, again, you feel like, oh, I'm just weird, I'm just
Yeah.
doing my own thing, I don't really know, I'm just goofing off. And, then you'd get yourself stuck into situations where then you're having to, like, advocate for the patient, being like, no, 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 like, there's more going on to this than I know what's going on. I need you to come see this patient. Like, I need you to come see this patient now. And first and foremost, I don't care what else you've got going on. Like, I'm really sorry, but I need you now to see this patient. And usually the docs are pretty good about, when I come up to them and say, hey, no, 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 like, I need you now, they're really quite good at saying, yeah, no, sure, let's go to see. And sure enough, like, 9 times out of 10, there was something more going on, or the patient was sicker than they seemed, just with a quick triage. So it's been
Mm.
honing that and kind of leaning into it, and then talking to other nurses. And then other nurses are saying, well, I do the same thing. I trust my gut, and my gut's saying that there's more going on, or there's something else wrong, or I'm missing something. And it's time that we start taking out of that, like, 3 a.m. joking conversation. We're talking about ghosts. We're talking about trusting our gut. It's a very woo woo topic, but looking into it and looking into the science, there's so much science, not just on intuition, but on specifically intuition in nursing, that
Yeah.
if there is science that's peer reviewed, science based, evidence based, whatever, we need to start teaching it. We need to start talking about it, because if we can develop this skill and have it utilized to its fullest extent, how many people can we help? How many people can we prevent from going into a critical scenario before it even
Mm.
happens? How many people can we, avoid an ICU stay, and we just a medical, and just have them be a medical stay? How many hearts can we prevent from stopping? Like, let's go with that.
Yeah. I mean, that makes sense because I feel like intuition is like the groundwork, because even in technology, the field I'm in, I feel like my intuition guides me. I may not know all the terminology, remember all the terms and everything, but I'll think I know how to do it. Put
You
me
know
in
what
it
you're
because I just
doing.
somehow you're guided. It's almost like a spiritual and science thing mixed together. It's like joining
As
each other, and I think it's the same in the medical field. So
very
I
much
totally
so.
agree with you on that one.
A lot of people talk
That's-
about the art of nursing, and what they're not saying is that there is more to nursing than and medicine than what we can see. How many years
Mhm.
before we realized what microbes were, or we could even see microbes, but they were the ones causing all these issues, until we finally figured out that they exist, and now we can treat them and all these other things. So how many advances are we going to make 20, 50, 100 years from now to be like, oh no, there
Mhm.
is, maybe an auric field or something, where we figure out that there is a way to determine that there's more going on with a patient than just what we can see.
Oh man, I love that. I love that. And that I love it. That's I never heard that perspective before from the medical field, and I think it's really interesting. So you have a book coming out,
Yeah.
and I'm excited about that. Can you tell us a little bit about what your book is about and your favorite chapter in the book?
Oh my god. So this is Nursing Intuition: How to Trust Your Gut, Save Your Sanity, and Survive Your Career. It was born out of a complete mental break with COVID and burnout and all these kind of things, thinking that I was going to die, and not knowing how to
Mm,
explain that to a 4 and 5-year-old at the time, why mom continued to choose to go to work. So trying
mhm,
to write down my really good stories, and then all of a sudden coming up with, like, the really bad stories, because you couldn't keep those down any longer. There wasn't that wall, because you had no other effort to keep it down. So all these, really traumatic stories come up and start bubbling up.
mm,
And it's time to start dealing with those. And in dealing with them all, realizing that the intuition was, like, a huge portion of it. There was this little thread going through all of these stories. Did I trust my gut? Did I not? Did I say anything? Did I not? And even if I did say anything, was I believed? And did the doctor do something, or was there a poor outcome? And so reliving those stories, and there's stories that I've told 100 times to other nurses about, we have little stories that we tell each other about, like, oh, this is why I'm freaked out about pancreatitis, or this is why I'm freaked out about ectopic pregnancies, or these kind of things. And so that's how we learn, is these little snippet of stories, but to go back into them and really sit back in those emotions of, losing a 2-year-old, or losing a 61-year-old guy who you advocated for, and you thought you were just too new to understand that there was really nothing going on, but sure enough there was something going on, and the doctor just put you off. It takes a lot of time to come to terms with, I did everything I could do. There was nothing more I could do. But having somebody validate those is everything. So I think my favorite chapter is just my first patient death was a woman who was just having a routine scheduled C-section. And, this is her second C-section. The first baby was born almost a day, like almost an exact year to the day of this one. And family was lovely. And so they bring me in. It's my first C-section. I've never seen a C-section before. I'm a student in a fourth year, so I'm almost graduated. And all of a sudden the anesthesiologist starts yelling stuff above me, and the monitor's beeping, but I don't understand what's going on. And the patient starts talking about how she's seeing God, and how she sees a cabin in the woods, and how she wants to go to God, and everything's going to be okay, and how she wants to name the baby this, and all these things. And as a student, I'm going like, what the hell is going on? And why aren't they bringing the dad in? Why is everybody seems like so chaotic? And it wasn't until they got baby out, and I didn't realize at the time they had to resuscitate the baby at the time. And so baby starts crying, and the mom looks over and she says the name of the baby, and then she codes. She
Oh, dang.
dies. She dies. It's my first code blue.
Oh,
My
man.
preceptor's on her chest. She's doing chest compressions. She's telling me to call the code. I'm like, what do you mean call the code? Like, I don't know what calling a code means.
Oh,
And
no.
going through the motions of everything. And so
Mm,
we get her back, and she's stabilized. We're transferring her to a sister hospital that specializes in heart care. And this is 8 a.m. on, like,
mm.
some morning during the week. And
Wow.
come the afternoon, they gather everybody into the nursing station. They're like, yeah, so just to let you know that she's died. I'm like, what are you talking about?
Mm,
She died. Like, I told her she was going to be okay. Like, I told her repeatedly that she was going to be okay, and it was going to be fine, and it was going to be no big deal. And you're telling me she's died? Like, wrapping my head around
mm.
that and trying to figure out, like, did I miss something? Did I not? Like, what even happened? Because I had no idea what had happened. And went home at that time. So I didn't finish the shift. I went home because I was like, I can't work right
Yeah.
now. Like, I'm in no mental place
Mm,
to be surrounded by patients. I probably shouldn't have even drove home, but got
mm,
home. My little sister was there. I crumpled on the floor, and she's like, what is happening? I'm like, oh my God, like, trying to explain what's
mm.
happened to, I think she
Wow.
would have been like 18 at the time, and trying to explain it. And she's not medical, so she's got no idea what I'm talking about.
Oh, no.
And
Mm,
and going to sleep that night, and having these nightmares about, like, I was the last person to talk to her. She didn't even get to talk to her husband before she died.
mm,
And she said all these things, and I was the last person she talked to. And it was just this idea that I was the last person that she talked to over and over and over again. And so I'm like, I have to write this all down. So I got up in the middle of the night. I started writing everything that I could remember she had said, especially everything about God, and seeing the cabin, and all these things, and seeing and hearing the baby cry, and naming her, and everything like that. So it was just,
mm,
overwhelming. And so the next day I went back, and baby was in NICU because she technically had to be resuscitated at the time. And
mm,
trying to find the family to give them these letters, because I'm like, there's nobody else heard anything of what she said. I was the one that she heard everything what she said last to. And so trying to
oh
find the
my
family,
goodness.
finding them, seeing the baby's beautiful, she's fine, there's nothing wrong.
Mm,
And then crying with the family about this horrific loss, because this poor guy is now a single dad of 2 under 2. Like, how do you grieve a wife when you've got a brand new baby and all these things. So it's
Mm-mm-mm.
it was a lot,
It's
but
just that is sad. I mean,
yeah,
that's an
I ended up
experience there to remember.
yeah, I ended up keeping in touch with the family. Facebook
Oh,
was just a thing at that point. So I added the family on Facebook. I probably shouldn't have, but I was a student. I wasn't really quite there yet. And so over the last 17 years, have gotten to watch the girls grow up, but I've watched dad get remarried and everything looks really good. And so when I was doing the book and getting it all ready, I reached out to him and I said, here's her
mm.
chapter. And here's the
Oh,
rest of the book, because I want you to know what the whole book is about. I said, if you do not want it, I will gut that chapter. I will never talk about it again. You say the word, this is your story as much as it is mine. So please, like, let me know. And he got back to me and he was just like, I am so thankful that you remembered some of these things. And, I had forgotten
mm,
all these other details, and there are things that you saw that I wasn't privy to. And you got to remind me about them.
mhm.
And so
Yeah.
it's been so lovely that he wants me to actually use her name in the book. And I said, "Ugh, I don't think I can, just with
Wow.
patient confidentiality and
Yeah,
everything. I still,
that's
even though
true.
she's been dead 17 years, but I still,
It
I
still
don't
feels
want
fresh,
to,
There's something.
well, it feels fresh, but then it also, like, I'm still very protective of my patients, right? And I don't know
Yeah,
if this
that
book
makes
will go
sense.
anywhere or do anything, and I would hate for it to complicate their lives in any way, shape, or form. So
Oh.
I'm gonna leave it without
Yeah,
her
and I
name,
think you
but
did the right thing. I think you did
yeah.
the right thing by not mentioning the name. I think
Yeah, it's
that's
just one of
fine.
those things where, this is her story, and those people who know me know exactly what I'm talking about. They know where I was, they know where I was working, kind of thing, or where my
Yeah.
placement was. But, I've been very intentional about removing my, resume off the internet and trying to not
Mm,
follow who I'm currently working for, just to protect any stories that could
yeah.
potentially be, linked back to me, just because it is patient privacy, and we are very protective
Yeah.
of our patients, and it would absolutely destroy me if anything was ever, linked back to anybody. Not that I think it could be, because most of these stories are greater than 5, 10, 15 years old. But I just
Yeah.
worry, you would hate for that
Yeah,
to
and I
be
get it.
somebody's thing.
I would be the same way. So,
Yeah.
what do you hope people can learn from your book?
I just hope people learn to trust their gut. I mean, every woman over the age
Yes.
of 12 knows exactly what trusting your gut feels like. You're walking into a party, you
Mhm.
see, or you're introduced to somebody and you're like, "Ugh, I don't think so." Or you're walking alone and the hair on the back of your neck stands up and you're like, "Oh, no, I got to be extra
Mm,
careful." Like, we know that feeling of trusting our gut.
mhm,
So I just want
mhm.
people to trust it in the medical sense, where, one, just realize that it's happening, and two, then give it a minute to, are you going to do anything about it or not? And but have that be a very thoughtful process versus just automatically, oh no, that's nothing, and brushing it off. For me,
There we
this is
go.
all about, if you just
Mhm,
realize that it's happening and we're just very open about
mhm,
conversations, especially those of us who are experienced, teaching those who are
mhm.
new that this is something that happens. It is something that can be cultivated and grown, and a skill that we can take care of. It's just like starting an
Yes.
IV. The more you do it, the more you trust it, the more it's more accurate. And that's all I'm hoping
Mhm.
for, is just for A, to open up the conversation, that B, we can start teaching it to those who are new, to hopefully avoid traumatic situations that may have been prevented.
I love it. I love it. I feel like they will get that from your book. I got a
Here's
feeling.
hoping.
I'm gonna get the book myself. I'm always buying so many books, but I'm gonna get the book when I finish my other book. But make sure I get your book because I'm
Oh,
trying to
thank you.
get back to my reading now. Okay, I got
It's
two more questions
hard.
before we close out. Oh, you said it's hard to read them
Absolutely.
all, huh?
No, it is hard.
Oh my
Like, so I'm an
goodness.
audiobook kind of gal because I've just got my kids, obviously, as
Yeah.
you've seen, are all over the place. And so I can't sit and read or else they'd be on
Oh
top of
yeah,
me.
true.
So I do the audiobook thing.
Yeah, audiobooks are good too. I do
I
use
love
Audible a
them.
lot. And
Oh
then
my God, I
and then
love
at night
Audible.
I'll like read. Yeah, Audible's cool. Like I got a few books on there. I actually have to catch up on. I have to get, and it's like crazy because I don't have any kids, so I don't know what my problem is. But I think
No,
just be all like
listen, you're
they'll feel
busy
big me
doing
in a
other
different way. I
important
don't know how to
things.
explain that.
You're busy
Yeah,
doing other
I'm like,
important things. Don't get down on yourself. That's just an easy excuse as the kids is a very easy excuse. If I really wanted to read the books, I'd read the books.
I know it. I know it. We'll both get to it. We'll both get to our reading. So I'm actually two more questions before we close
Yeah.
out. The first question is, it's good. Well, this one's going to be a would you rather. So it's like a quick little would you rather
Yeah.
game. It's like one question or two. So the first one is, would you rather have a day where everything goes smoothly without any intuition needed, or a day full of surprises that test your intuition at every turn?
Me being the person who needs the universe to slap me across the face in order to get anything done, I would choose the hard day that I need my intuition. Because when you get that hit
Yes.
and then you're right and you're validated, it is worth every ounce of pain that you've put into that day. I 100% would go with the intuition day because the regular days, the smooth days are fine. You need them to kind of balance everything out,
Yeah.
like everything else, but they're boring and they
Yeah.
drag on forever.
Mhm. Yes. And how do you learn? Shoot, if you don't get hit in the head a few times. I love it.
Exactly.
And yeah, you got to get hit in the head a few times so you can learn the lesson. That's the point. It
Right.
makes life worthwhile and purposeful.
Ugh.
So, what's a saying or quote that you go by?
Um, the easiest one is it's not life or death. So when a minor inconvenience happens and it's like, somebody's apologizing, oh, your coffee, it's taken me 2 extra minutes to make your coffee. I'm so sorry. And I'm like, it's not life or death. Like,
Hmm.
that's my standard for getting upset. Like, is it life or death? Because truly, the 99% of the things that we're getting upset about on a daily basis are so minor that we're actually very
Hmm.
privileged to be able to get upset about these ridiculous little minor inconveniences. But the other
Man.
one is just it is what it is. And it's a little defeatist at times because it's like, what am I going to do? It is what it is. But sometimes it's just you're having that really crap day and you can't understand, what you could do better or whatever else. And the day is, it's a
Hmm.
dumpster fire of a day. And it's like, well, is what it is. We're just gonna kind of move through the
Yep.
day and do what we need to do and keep going. But there's nothing that you're going to be able to change about it. So you're just like, it is what it is. And you just kind of, just keep nursing kind of thing.
Just keep swimming. I know. I
And
totally
that's
agree.
the
I
that's the
mean,
joke,
because
right? It's like just keep swimming, but it's like just keep nursing, just keep nursing.
yeah, just keep going, especially when you love what you do and you feel this is your
Yeah.
purpose. I think it's the because complaining is just isn't going to help. But venting is okay. But it's
Venting is
just
great.
it is what it is, and that's important. Yeah, because I think it's okay to vent certain things to the right people.
Absolutely. Absolutely. Yes. Be
Vent
very
to the
careful of
wrong
who you're
one.
venting to.
Yes, please vent to the right person. So go ahead and shout out where people can follow you at and buy your book. I'm going to put in the show notes, but you can shout it out just in case somebody's
Yeah. So you
laying
can find
down.
me at RX for Growth, prescriptionforgrowth.com. You can find me on Amazon. If you search Jennifer A. Johnson, RN, you'll find me and all of my books. I've got some journals for nurses to try and help you keep track of your growth. You can find me on TikTok and Instagram at ernurse.jen, Jenn, and LinkedIn, Jennifer Johnson, BSCNRN is where I'm probably the most active, just because it's the professional side of things, and sometimes that's where you need to be to get things going.
That's true. I like LinkedIn. So I want to thank you for coming on the pod today. I had so much fun speaking with you, and I'm sure the guests enjoyed it and learned something. And I want to thank everybody for rocking with me. Please subscribe and share because that helps me grow and helps my guests grow. So thanks for listening, everyone, and talk
Thank you so much.
soon. Peace.
Thank you so much for having me.